housekeeping rules and the administrative rules. But I just wanted, if you didn't hear me, I wanted to welcome everyone. Thank you for joining us, to our partners at our COAs, as well as the program directors here who are going to give you information about the services and the programs that are offered here and how you can access them. So as you just saw, today's event will be recorded and you will be getting a copy of the recording of this. Lorna will be driving this. She will be the host. And in order to maximize viewing, put yourself in speaker view. You see only the person speaking, and gallery view if you want to see all the other attendees as well. So Lorna has muted you all. So, just in case you didn't mute yourself, Lorna has done that. For those on a computer, the host will send a prompt to unmute when it's appropriate. For those who have dialed in, you need to press *6 on your phone to mute or unmute. So if you could make a note of that. And then when we get to our Q&A section, which will be at the end, Lorna will unmute us all so that you can ask your question. And when you're going to ask your question, if you could please raise your hand in the Zoom toolbar. So I will be calling on you, not to make it, anything like school, but just to, know who has a question, and I can, call upon you. And then from a phone, to ask any questions, press *9, which will display a raise hand to host the signaling of a question. Okay, next.
Am I up next, Sean?
Yep, so without further ado, I should say, let me introduce Dan O'Leary, our CEO here at Mystic Valley, and he will give you an overview of our agency. Dan?
Thanks, Sean. Just for those folks, just to pick up on one little thing that Sean was talking about at the end where you raise your hands, for those folks who maybe not use Zoom every day, the raise hand feature is in the toolbar at the bottom, and it's under the reactions section. So if you're looking to raise your hand, that's where it is. So hi, good morning. Seems like morning. Good afternoon, everybody. It's been a crazy day, needless to say, with the weather and trees down and power outages and trying to deliver meals here. And Angie's back, and I think she's dry. I hope so, anyway. But she's safe. And I hope everybody else out there is, all your staff and the COAs are safe as well. So I have 4 minutes left here. So my overview of Mystic Valley is effectively going to be done by all the speakers who follow me. Let me just kind of give you the highest level overview of Mystic Valley. For those of you who've been around a long time, you know this already, but we have some new folks on this call. Mystic Valley, we're a private nonprofit organization. We're not a municipal organization. We're not a government department, so forth. Mystic Valley was incorporated back in 1975, and we've been serving, I'm going to say, the 11 communities in one fashion or another for the past 46 years. And it's been a privilege to do that. When I say we serve the communities, I'll put it in the context that Mystic Valley's role, I'll say this is in a very macro way, almost in a gross way, we'll say it, is to help provide services to people who need help in their homes. And I say that in the way we've always approached it at Mystic Valley is our job is to assist people to live independently at home. What that means is primarily is those services are going into their homes, whether they're Meals on Wheels, whether they're services through a personal care service, helping you get up in the morning, helping bathing, dressing, toileting, all those sort of things. But they're targeted to the individual who is, I'm not going to say homebound, but needs assistance at home. The reason I emphasize this is our role is primarily there. And for all of you in the municipalities, the towns, cities and towns, and the elder service programs, the human service programs, I see your role as primarily helping people get out of the house, get to the senior center, engage in community life. And so at Mystic Valley, I believe we have successfully, and I hope we continue to do so, see each other as equals and as partners in helping deliver services to people where they not only need them, but where they want them. So our job is not only, as I see it, to help people be successful in their home or their apartment, but when we can, to encourage them to engage in community life. And that is what I see in large part is what happens at senior centers and other places in the community. It could be libraries, it could be other churches, religious organizations, other groups, and et cetera. And when we can help facilitate that, that should be our role. So I think what this is all about to me is creating and sustaining and improving the partnerships between councils on aging and Mystic Valley, because there's, I think if there's one thing we can all agree on in this call, there's way more work than either one of us can do on any given day. So if we get together and we continue to get together, I think we can do a better job together than if we're apart. So that's my overview. We're here as your partners, as your equals, and as advocates for the residents who live in collectively our communities. Okay, Sandy, now you can do all the hard work.
Hi, good afternoon. I'm Sandy Fall. I'm the Director of Eligibility and Enrollment. And I've been at Mystic Valley for about 21 years. Next. Okay, I oversee 3 teams. I oversee the information and referral team, and I oversee the intake team, and I oversee our nursing team. So I'll start with information and referral. We have a team of 5 information and referral specialists with 1 manager. Some of you may already know her. It's Chrissy McKeeman. She does some outreach, and you've probably talked to her on the phone if you haven't met her in person. And she supervises 5 information referral specialists. So we get, I forget what our number of calls is every day, but we get a lot of calls for a variety of questions and information. So we provide resource information via phone, email, mail, and in the office. And we also have a website now where we get a lot of requests for information via our website at this point. You can also, just an FYI, make a referral to us on our website if you want to refer a person. We conduct pre-screening to determine the most appropriate referral to internal programs as well as to external agencies. So even if they're not going to open to Mystic Valley in any of our programs, we do our best to assist people with finding the best resource in the community. And sometimes that's the Council on Aging. It could be anybody. We also schedule home care program referrals. So if it looks like when they pre-screen someone on the phone and they want services, they're going to schedule an intake worker to go out and conduct an in-home assessment. And we also maintain a resource database so that if someone's asking for, home hairdressers that do home visits, that's one of the calls we get, or podiatrists who do home visits, we try to keep that database up to date and be able to provide current information. It changes quite a bit, so it's a challenge to keep up with going on in the community. Next. Okay, so we have 10 intake care managers and 2 managers. And when information and referral specialists schedule a visit, they contact the consumer to confirm the appointment and they go out into the home. So if they want Meals on Wheels, but they don't want to answer all the questions on our assessment or give their financial information, we may refer them to our nutrition program, and they're not going to become a home care program consumer. We go through financial eligibility, we go through need eligibility. If someone just wants homemaker and they really are not very frail, they may have a neighbor who's been grandfathered in who gets homemaker services, but they're not eligible at this point to get into the system perhaps. We go out and we decide which program would work for them best. And the home care programs, is a variety of them. So depending on their frailty, we're going to try to enroll them in the most appropriate program to meet their needs. So we make referrals to They also make referrals, and they use the information referral department also to give resources and information. If they are eligible for the home care program, one of our home care programs, the intake case manager develops a care plan with the consumer, and we try a person-centered approach where the consumer is in charge. We look at all their informal supports, we look at their need level, and with that consumer, we're going to try to develop a care plan. And as you may be aware, we do have some budget constraints in some of our programs. So sometimes people need more than what we can offer, depending on what they're eligible for in terms of programs. You've heard of the waiver program, which is a Mass Health program, and we have more flexibility with that to meet folks' needs. But in the meantime, we try to provide informal supports with resources and, in addition to what we can provide. And we arrange services to the best of our ability. As you know, there's a worker shortage right now. And one of the biggest challenges we're facing right now is, yes, you're eligible for services. You can have 6 hours a week of service, but then there aren't the workers to provide the service. And that's provides a level of frustration for both our staff and the consumers and their families, because they are eligible to get services, yet we don't have the workforce to meet the need. We keep an eye on it. We work with our providers. We try to encourage consumers to be as flexible as possible about scheduling. And it's still just hard right now with the service shortage. But intake case managers are pretty knowledgeable in terms of other programs that might be available, private pay resources and other information. Next. Nursing. We have about 20 nurses and 3 nurse managers at Mystic Valley, and we have a variety of roles. We do assess, we conduct in-person assessments for personal care, home health aid, services like that. So if an intake worker goes out or a case manager goes out and they determine that the person needs assistance with personal care, they're going to make a referral to our nurses. So it happens at the intake level as well as ongoing case management. Someone might have had a fall or had a medical crisis, and now they need personal care. So our nurses go out, develop a care plan for what that's going to be, and then we send it to the service providers, and then their nurse goes out and trains the worker on what to do for our consumers. They also are involved when someone is really frail and they're eligible for the waiver, they're on that Mass Health program. We can give quite a bit of hours, but the nurse will go out and assess, the case manager goes out and assesses, and we all get together and talk about what's the best plan for this person. And we need to do that every time someone needs a lot of hours. And then we also, something that not everyone knows about is we have a contract with Mass Health to conduct screenings for Mass Health recipients. So for example, someone might not be a home care consumer, they might not be connected with Mystic Valley in any way, but our nurses go out and determine if a person is eligible for Mass Health to pay for adult day health, for nursing homes. So we have a contract with Mass Health that really is separate from the home care programs. And I hope I didn't go over my 5 minutes. It's a lot of information to put out there, and there are a lot of other people after me. So if there are questions, I'm available at the end. Okay, next.
Thanks, Sandy. Hi, I'm Joanne. I think Sandy was supposed to be introducing me. I'm Joanne Salazzo, Director.
Oh, sorry.
That's okay. I've been with Mystic Valley for about 35 years, mostly as Director of Client Services. And one of the main components in client services is we follow up from what some of Sandy's staff do in terms of the intake care managers. When they complete their assessment with a new consumer, they pass that consumer on to one of the care managers in the client services department. Right now, we have 48 care manager positions, and their main function is to do similar assessment to what intake has done. However, it's a follow-up and it's a check-in in terms of how are the consumers doing at this point. For one program, we visit twice a year to do that ongoing assessment. For the more intensive programs, we visit either 4 or 6 times a year to do that assessment to see the consumer status. Hopefully, we have been able to maintain them safely and with some dignity in their home. If their needs have increased, we look at that and try to increase according to what we can do with budget, and to keep them and safely in home. But many situations change for people. They may have a loss in their caregiver system or the support system, so their needs may be different when we see them, and we try to meet those needs as much as possible. We also, client services encompasses many different positions. In addition to the 48 care managers, we have what we call our supportive housing program. And many of you in the cities and towns we work in have a site or more than one supportive housing site within your city or town. We have 16 different sites, and we have what we call our resident service coordinator at each one of those sites. The resident service coordinator does the same function as our care manager. They are assigned to that building for the particular residents that are enrolled in our programs and do the ongoing assessments. But the other part of it is that they're also available and present to all the residents in the building, which I think is one of the greatest pieces of this program, because not everybody needs services right away or wants services, but when the time comes, hopefully by our presence in that building, they know who we are. They don't have to try and figure out, what do I do when I need somebody to help me? And they connect more quickly and easily with a resident service coordinator who can do that initial intake, set them up for services, and then they can be ongoing consumers with us. We also have clinical caseworkers who work with consumers who have behavioral health concerns. And the clinical caseworkers on staff are not licensed clinicians. They are licensed social workers. But to fill the need for ongoing counseling or therapy, we contract with several mental health agencies, Elliott, Riverside, and a few others, to provide therapists who can go into the home to provide ongoing counseling. It does fill a small need. We don't have a huge amount of therapists with hours available, but we do have a significant number that can help people. We also have options counselors within client services, and they deal with folks mostly who are not eligible or do not want services. They do an assessment, not as lengthy as the assessment we do for home care services, but they do an assessment to determine what the needs are and create a plan for these people and offer them resources and do more of a short-term intervention, supposedly for 6 months, but a lot of times we have people much longer than 6 months. Don't tell anybody. We also have a caregiver support program, and Kathy Learned's going to be talking about that. We have a protective services program. Brian McDonald will be talking about that. And we have a good amount of managers within the department to help us get all this work done. Some of the services that we're able to offer when we do these ongoing assessments are homemaker services to help with daily tasks, personal care attendants that help with bathing, dressing, toileting. We also, within that category, have what we call supportive home care aides who are trained more extensively to deal with some of the more challenging situations that consumers face. We have home health aides that assist with bathing, dressing, home delivered meals, grocery shopping, laundry services. We authorize attendance at adult day health, provide transportation to medical appointments, and offer support to folks through our clinical caseworkers to folks with behavioral health concerns. That's a real fast, quick summary of what we're doing in client services. So now I will pass you on to the esteemed Brian McDonald, who takes care of anybody who needs protective services.
Thanks, Joanne.
Okay.
Hi, folks. I'm Brian McDonald. I'm the manager of protective services, and I've been with Mystic Valley in this role for 20 years now. A lot of people think with protective services being heavily regulated that it's pretty black and white on when we go out, when we get involved, but I'm going to say that it's a lot of gray areas. So even after going through some of the information I'm going to go through, if you have particular situations that you want to discuss, feel free to send me an email. You can reach out to me by phone, and we can discuss the situation to see if it should come into protective services or maybe it should go to somebody else in our agency. So as COA directors, you are all mandated reporters. That goes along with the outreach workers as well as any nurses or licensed social workers at your building. In order to file a report, you can do it a couple different ways. The main way is to file an elder abuse report through the elder abuse hotline, and the number there is 800-922-2275, and they are open 24 hours a day, 7 days a week. What's become more popular in terms of filing a report is to do it through the online website. The link is on the Mystic Valley website as well as the mass.gov website, and you can go on and file that. What we're hearing is people out there saying it's a little easier to do it online just because they can do it at their own speed. There's no wait times in terms of filing a report, and we get it much quicker than going through the hotline itself. We investigate reports of emotional abuse, physical abuse, sexual abuse, caregiver neglect, financial exploitation, and self-neglect. Coming out of COVID, we're seeing an enormous increase in financial scams. And you've probably seen a lot of them yourself with the people that have come into your buildings. Technically speaking, scams are not our jurisdiction. They are considered to be a crime and should be reported to the police. However, there's the scams where the elder is financially exploited through gift cards. So that's a main concern because the elder actually has to do some sort of action to get scammed. And we find that the elder going to Walmart, CVS, purchasing gift cards, thousands of dollars worth of gift cards, and then supplying that gift card number to the scammer is something that we want to check. So we want to check on the elder's cognitive ability to understand what they actually did, and then to see what impact that scam actually had on that elder. So in terms of that case, we may bring that in on a self-neglect issue with more of a financial mismanagement, just to see how that elder is operating and does it have impact on the elder? Is the elder able to pay their bills going forward? So we may get involved in some of those cases. Right now, we take in approximately 150 to 170 reports per month. And those reports will be screened according to state regulations. If there is a reportable condition and the case would be screened in, it would be assigned to a protective service worker. And many of those people you'll see come through your buildings from time to time. If that case is screened out, you will be contacted by the screener to discuss the intake. Maybe there's some additional information that you have that could allow the screener to screen that report in, or maybe we could come up with some different avenues for that elder, such as a referral to the home care department. There's also some cases where if it's a low risk case, we may screen it out to home care because it's better to introduce an elder to Mystic Valley Elder Services through the home care department than protective services, who by regulation has to show up unannounced. A lot of times that can be intimidating to an elder. So if we do screen in a report and conduct the investigation, most investigations last approximately 30 days. During that time, we will assess the allegations, assess the capacity of the elder, assess the risk associated with the incident, and also basically see the impact on the elder. You and I may look at the situation and say, that's not a good situation, but the elder may look at it and say, this is the situation that I know, this is the situation that I want. So the risk may be lower to the elder than what we're seeing. So if at the end of the 30 days, if the case is unsubstantiated, again, we could then refer it to home care. We may also refer it to a community mental health agency. If the case is substantiated, it is put into ongoing services. And ongoing services in terms of state regulations would last 1 to 4 months, which a lot of people say, wow, that's not a lot of time. But they look at protective service involvement as being short-term, lower the risk to the elder, alleviate some of the situations that are going on, and then pass it on to an appropriate agency. So during those 4 months, the protective service worker may refer it for domestic violence counseling. It may go to home care. It may go to, like I said, a mental health agency to work with the elder. But the main goal, the main focus is to alleviate the risk of the situation that's currently going on. So again, I stress that if you have a situation, get in touch with me. If you don't think it's reportable, we may talk about some different avenues that it can come into protective services, but it may be something else that would be beneficial to refer to another part of our agency. One of the main people that we do use is caregiver support in terms of caregiver neglect, where it may be an education piece, and I don't want to steal Kathy's thunder, but it may be something where the elder and the caregiver could benefit from being educated and provided assistance that way. So with that being said, I introduce the caregiver support coordinator, Kathy Lerner.
Thank you, Brian. So we'll start right up and we'll show the next slide, please. So family caregivers, their spouses, their parents, their relatives, they're actually friends or neighbors that become someone's family. Someone has to be 60 years of age and older, unless they're caring for someone with dementia, and they can be of any age. They're grandparents that are age 55 that have custody of their grandchildren. And they're also folks age 55 and older that have, they're caring for a disabled individual. Generally, those folks we work with are with DDS. Next slide. So the work of caregiving is really hard and it's very stressful. Most of the times, the folks that I'm working with, it's chronic, ongoing, it lasts years. I know folks for years. And it may start out as an acute crisis and their whole life is in a whirlwind, but then it's just ongoing and it's very, very difficult. And there's no training to be a caregiver. It is on-the-job training. So, actually, it's very stressful. So the next slide. And it's isolating. People's worlds get very, very small. It's very physically exhausting and it's emotionally draining. So what do we do? Next slide. So what we try to do is to offer a one-on-one counseling session. A lot of these folks that come to the caregiver support program have never been part of Mystic Valley before. Maybe they've had a medical situation and maybe the doctor says you need help, or it's a family member that says you need to get some help, or it could be protective service saying, please reach out to this family. So then it's a matter of getting on their terms, and they may want to meet at a coffee shop or a park bench, or I have met at the Council on Aging, and I appreciate that so much. It's in their community, it's private, it feels safe. And then what I want to do is to meet in the home environment, to meet the person they're taking care of, because that's how you see what's really going on. And you see how people interact with one another, and you see how they talk to one another, and you see what's going on in the home to assess for other things. Not only will I meet with that caregiver and their loved one, then also we offer family meetings, because there might be one caregiver, but their main caregiver, but there could be 3 or 4 other family members that are taking turns. So maybe they need education, and so I'll offer a family meeting, or maybe a little mediation to get people on the same page. It also could be one family caregiver that has other family wants to bring other people involved. And so maybe to see how everyone can kind of pitch in, and maybe to ask for help and teach them how to ask for help. Next slide. And so then people need a respite break. But like I said, a lot of folks they don't really know what they need. They don't know what they want. Their world's gotten small. And they also are very protective of the person that they're taking care of. So what can they give up? Sometimes it's me convincing someone they could give up maybe washing the bathroom floor or the kitchen floor. And I'm serious, and that could take a long time, even though they know they're stressed out. Or maybe it's adult day health. to teach them what that is. Not everyone knows what adult day health is. And then they think, oh no, my loved one will never go. They'll be upset with me. They'll be mad with me. So then it's a matter of knowing who their loved one is, not giving them 3 daycares to go to, but to pick one, making the referrals, and then the strategies to get the loved one out there. It could take weeks, it could take months, but once they get there, another barrier that we want to be able to overcome is maybe financially. So they don't want to answer a lot of financial questions at first, maybe. So I may be able to give them a trial of day program. And once they realize it's a gift for their loved one and themselves, I'll then refer it to home care for the ongoing service provision. So they also have that increased support with a case manager. Then I'll work with the case manager to see what other unmet needs there are. So it's trying to figure out what respite will work for that family. So next slide. And what Brian was saying was the education piece. That is huge. And it's all free. One of the things we do is we offer the Savvy Caregiver. That's a 6-week evidence-based program. We have been fortunate enough to partner with North Reading a few times, Wakefield, Stoneham, we've invited. We've done it on the Zoom platform now, and we'll continue to do whatever people would like us to go. We also have the support groups. Again, so happy that we're out there face-to-face back at the Stoneham Senior Center and Winthrop. Makes it easier for people to get to, the community support groups. And we're also running them still on Zoom because people realize that that's very helpful. So it's kind of a hybrid that we're doing. So we do those educational things one-on-one and in groups. And of course, we will make referrals for mental health and coaching. Next slide. And the last thing is a little other funds we have is for supplemental services. So again, it's all case by case with these particular caregivers and what they need. What is really helpful is technology. That's something that's not really covered anywhere else. And we have the opportunity to use things that are different. What I have found, for example, in the last year, which has been very exciting, is a GPS watch that actually tracks people in real time, not where they were a half hour ago, but where they are now. And somebody that maybe needs 24-hour supervision, and the app can be downloaded on the phone, but a loved one, if they're taking a shower, for example, and the person walks out with the door alarms, that loved one can see they're in the corner of Broadway and Eastern Avenue, get them right away, call a family member, call the police, keep them safe. So we're working all together to keep people safe. Other things are cameras. Cameras are a beautiful thing because you can do a wellness check from across town, from your office at work. You can say, Dad, take your medication. I want to see you get the orange juice, put the pills in your hand, and I want to see you take the pills. It's genius, really, that we can do so many things outside the box and try to support these family caregivers. So that's really just a quick overview, but call us. And so we will get out there. So I now want to just turn it over to Angie Fitzgerald, our nutrition director. Thank you.
Thank you, Kathy. Hi to everybody. Welcome. Dan, I did make it back safe, and I just wanted to, a little light note for today. I got more compliments about my hair today than I've ever done. So I'm going to resort to the windswept look from now on. That was just my education piece for today. So nutrition is, business is booming. We're delivering over 3,000 meals a day on average. We currently offer 15 different meals, and that's a combination of therapeutic meals, cultural meals, regular meals, and we're also going to be adding Russian and Haitian meals in December. We also have weekend meals for those folks too. We currently have about 75 field staff with 10 or 12 in-house staff. So we just switched over to all our drivers having smartphones. So we've made some adjustments in the office, but everything seems to be working, fairly well, which is good. And of course, we collaborate a lot with our COA partners, and we're very grateful for that partnership. We have a lot of our Meals on Wheels drivers picking up meals at the COAs, and we appreciate that we're able to use that space. Hopefully my staff are behaving. And right now we're doing a mixture of, obviously the pandemic totally made us have to think outside of the box and do things a little differently. But a lot of the, the meal sites are back up and running in some fashion. We have a mixture of grab and goes. We're back to doing like a sit-down lunch at the supported housings. A couple of the Revere and Medford definitely are doing sit-down lunches again in pretty decent numbers. We also have boxed lunches available. We're doing a big lunch at Chelsea tomorrow and again in Medford on Friday. So, you know, there's, I think people hesitant to come back to the sites, but it seems like a lot of people are getting a little more comfortable, and I'm sure those numbers will continue to rise. Other partnerships we have with the COAs, as many of you know, is the farmers market coupons. Again, even over the last couple of years with all the restrictions, we were able to give out over 1,000 of these coupon books, $25 worth of coupons so that people could use it at the farmers markets. I have 2 dietitians who frequently visit the COAs. They do nutrition education, and of course they're instrumental in the coupons also. And we're hoping that you know, we can get back to doing more educational pieces and with your collaboration. Other 2 events that we like to do, we did some summer barbecues this year, and we hope to get back up to full capacity next year. And as you know, we have traveling chef opportunities. So again, we like to partner with you guys and have entertainment lined up to coincide with those things. And usually we get, you know, really good attendance at those. So, you know, we really, really value the partnerships we have. And for those of you who are new and maybe don't know all the different options, again, this is just a brief overview. So feel free to reach out to me after, or if you have any questions. The other big program that continues to grow for us is our Insure program. We're delivering about 175 cases of Insure per month now. So it's really become its own mini program within nutrition. And I've got a great manager who's running that for me right now. So that's pretty much, you know, in a nutshell, what we're doing over here. And again, if there's any questions, feel free to ask me. And now I hand it over to my wonderful colleague, Lauren Reed.
Okay, hi everyone. Can you hear me? Good. I'm Lauren Reed, Director of Community Programs in the Agency Planner. I've been in home care for 25 years, but I'm here at Mystic Valley Elder Services for 17. So Community Programs Department, what do we do here? So we provide resources to people in addition to the standard services within the home care scope. We're open to people in the wider community of our 11 cities and towns versus just home care enrolled consumers. And we are staffed by both paid staff and volunteer staff. In fact, the volunteer support is a central focus to the programs that we offer to people. So the Healthy Aging Program offers a variety of free evidence-based programs to promote health and well-being with a strong focus on helping folks living with disability to manage their chronic health concerns. Train volunteers, lead classes that include like Tai Chi class, which is probably our most popular, matter of balance, healthy eating, and chronic pain, disease, diabetes, self-management class, and many others too. The money management program, that's designed to help folks who need help with their bill paying tasks. So trained money management volunteers called bill payers help people organize their personal finances and pay their bills, balance their checkbook, and kind of set up a monthly budget to help them succeed over time. And the SHINE program stands for Serving the Health Insurance Needs of Everyone. And so trained volunteer SHINE counselors offer free, unbiased advice to Medicare recipients who may have questions and concerns about Medicare, mass health, prescription drug plans, and health insurance plans. The newest program that we have is the social engagement program. And this offers a variety of opportunities for social connections for people who are, exhibiting the negative health outcomes of isolation. We've been kind of wanting to address this for a number of years now, but COVID really brought it to the forefront with all of the isolation that we saw that people were experiencing. So trained social engagement volunteers connect with people through a variety of levels of services. Some people are shy, they don't want an in-person interaction. They might feel better with just a telephone call. So we've designed a program that has telephone reassurance calls, an email pen pal program, a card and letter sharing service, which a consumer actually suggested, because some people still love to get cards in the mail and they enjoy writing letters back and forth. And then, of course, we've got the friendly visitor aspect of the social engagement program too. Now, this transportation services can also be found in community programs, and it covers the gamut of support, including providing people with just packets of information about transportation resources in their specific neighborhood. Other times we just assist people in telling them how to sign up for the ride, or mass health transportation, or the TRIP program, which is a volunteer driver service, right down to arranging the rides through our contracted vendors like Malden Taxi or Suburban Coach. Typically, the need for transportation centers around medical appointments, as you can imagine. But from time to time, we're also able to tap into additional resources so that we can help people get to social events, visiting family and assisted living, classes, and things outside the traditional medical needs. Grocery shopping is one of them too. So our volunteer engagement program is really central to our whole department. It staffs the community programs that I just told you about. And we always talk about it as having a dual mission. So we aim to alleviate community problems. We tap into the skills of our 300+ volunteers to alleviate community issues. But we also make it a point to cultivate really worthwhile and meaningful volunteer opportunities, because we see that as just another way of serving folks. So we hope it's a win-win situation for both the consumer and the volunteer who gets to contribute and feel like they can connect to their community. Now, I'm also the agency planner. So as one of the Massachusetts federally designated area agencies on aging, or the AAA, we are charged with administering, coordinating, and monitoring needed services in our area. And every AAA has a designated planner who's responsible for developing an area plan about the needs that we are seeing in our area and laying out a strategic plan to address those. So our most recent needs assessment project, it was a huge project. It was this time last year. I got loads of help from everybody in the community and in Mystic Valley Elder Services. And we were able to get over 600 responses from people. And people expressed all sorts of concerns about what folks need to live well in the community. But overwhelmingly, the top 4 needs people told us about were social isolation, finding affordable housing, addressing the digital divide, seeing what we could do to help elders learn technology so that they could tap into health supports. And then a lot of people were concerned about learning about all the services and programs and figuring out how to access them. So although we've got a lot of missions we want to get to, those are the ones that we're kind of focusing on right now. So we look to both internal resources like Kathy's caregiver program, or like the housing specialist program, to address the needs that we're seeing. But additionally, we grant out Title III funding to grantees in the community who have a plan for addressing the same needs that we're concerned about. So for example, for federal fiscal year 22, we're partnering with 11 grantees. And our grantees, for example, among other service activities, teaching technology, are holding social activity events, and helping people with housing crises. So in essence, the grantees help Mystic Valley meet their obligation and their AAA goals to help elders and caregivers thrive in the community. And we're really creating a huge network of partnerships, and we're all working for the same cause. So, as Dan said, none of us could do that alone. So thank you for your time. Thank you for listening. And I'll turn this over to Amy Cataldo.
Thank you, Lauren. Hey, everybody. My name is Amy Cataldo. I am the Director of Integrated Care. I've been with Mystic Valley for a little over 6 years now. Next slide, please, Lorna. So in my department, our programs include Senior Care Options, One Care, and our newest program, which is LTSS Care Partners. So all of these programs are partnerships we have with various health insurance plans, managed care plans, and we provide a lot of the services similar to our home care side, except it's through those partnerships with those plans. We also service adults with disabilities, sometimes as young as 18, in our One Care and our LTSS CP plans, which is a little bit different than typically our 60 plus over on the home care side. So it is a great opportunity for Mystic Valley to work with some additional people in the community who have in-home service needs. Next slide, please, Lana. So Senior Care Options is our biggest program at Mystic Valley by far. Senior Care Options started in 2004. We have about 3,500 elders that we provide support to through these programs. There are 6 different plans in the area. All these plans are Mass Health plans. Actually, in our department, everybody has Mass Health. So we're working exclusively with low-income elders and adult with disabilities. These are voluntary enrollment plans. The great thing about all these insurance plans is that everything is free. There's no copays, no deductibles, no premiums. Coverage has a lot of added benefits over if somebody just had Mass Health and Medicare alone, including enhanced dental benefits, covered dentures, covered implants now, vision, hearing, free medical transportation, some non-medical transportation to the grocery store and whatnot. There is over-the-counter benefits that the plans, since they are all competitive, like to keep upping all the benefits. They will reimburse for a gym membership sometimes, extra acupuncture benefits. So it really does benefit the elders that the plans are competitive with each other. So our team at Mystic Valley, we provide geriatric support services coordinators or GSSCs to work with the SCO care team. So we are part of the care team for the elder. Everybody else who is working with the elder is employed by the Senior Care Option Plan. So we also provide a lot of advocacy and a lot of information on other community resources in our role at Mystic Valley outside of what they just get from the employees of the plan. So next slide, please. So to be eligible for a Senior Care Option or SCO plan in Massachusetts, you have to be 65 plus and have Mass Health standards. So that's as simple as the eligibility is. There are 6 plans in our area. Our 4 biggest by far are CCA or Commonwealth Care Alliance, United Healthcare, Senior Whole Health, Tufts Health Plan. Those are the 4 that are the largest in our area right now. Next slide, please. And then there's One Care, which is very, very similar to SCO, except it is for disabled adults aged 22 to 64. To be eligible, you have to have Mass Health and Medicare. And similar to SCO, the plan is free. No copays, no deductibles. It includes everything covered by Mass Health and Medicare originally, as well as in-home services. So it's like Mass Health, Medicare, and home care put together. There are 2 One Care plans in our area, Commonwealth Care Alliance, Tufts Unify. We have about 300 One Care consumers. This is a newer plan. SCO started in 2004 and the One Care started in 2013. Next slide. And then this is our newest program, the LTSS Care Partners program. This is a Mass Health demonstration of a 5-year kind of trial program that started in 2017. And we partner with a number of different organizations in the area, VinFen, Bay Cove, Boston Senior Home Care, Somerville, Cambridge Elder Services, and Justice Resource Institute, or JRI. So through this program, collaboratively, all of us together actually serve adults age 2, I believe it starts at age 2, through 64, with Mystic Valley helping more with folks on the elder side. So this plan is really not as focused on the vendor-based services and the homemaker and the personal care that we get to provide in our other programs. It's more so on social determinants of health, helping people high risk stay in the community. Most of our referrals are people with physical, developmental, or acquired brain or traumatic brain injury disabilities. They are mass health only, so they are low income, and these are people that have been disabled for the majority of their adult life. They have not been able to work or pay into the system, so they're not Medicare eligible. So our integrated care coordinators at Mystic Valley, we work very closely with primary care teams in order to help get people more engaged in their healthcare, in the hopes of, reducing emergency room visits and hospitalizations and getting people more engaged with preventative and primary care. So this is quite a challenging program, but it's been a great expansion because ACO Plans Mass Health is really focused on increasing the accountable care organizations, their involvement with managing the care overall and the total cost of care in Massachusetts right now. So again, this is a 5-year demonstration, and one of our smaller programs, we service about 150 people under this program. I think is that my last slide? Oh, so here's eligibility. 18 to 64 is who we assist with in Mystic Valley. And we get to partner with a lot of local groups that I'm sure everyone's probably familiar with. Mass General Brigham, or MGB, which was MGH and Brigham and Women's put together now, or they were partners too. So the newest name is MGB. Also with Community Care Cooperative, they're an ACO, and that includes East Boston Neighborhood Health Center. So we work a lot with them and their patients. Cambridge Health Alliance, of course, we work with them. They have an ACO partnership plan with Tufts. Wellforce, which includes Melrose Wakefield Hospital. They have an ACO partnership plan with Fallon. And then Tufts Beth Israel also in the area. So we work with a lot of the medical groups at the primary care level, which is great in this program. And that's all for me. If anybody has any questions, I know insurance is confusing and all that, navigating all that. And a lot of times, as these plans continue to grow, I'm always happy to help and provide education. When I came to Mystic Valley 6 years ago, we had 7 people in our department, and now we have 36. So that shows you how much the enrollment's increased, and we keep creating positions and adding to our partnership with all these insurance plans. So now I'm going to pass it to Jenny, our Director of Development.
Thank you, Amy. Everyone, I'll keep it quick because I want you to have time to ask questions. I'm Director of Development. Our development team, our purpose is raising funds to help support our mission. Why are we raising money? You just heard about all these wonderful programs, but even with all the programs and with the government support we get, there are still needs that our clinical teams and our staff go out and find, or people call us about, that fall in the gap. And we want to be able to have resources available that you out in the community can turn to, call us, let us know if someone needs help. We want to be able to have resources that can help the people in our 11 communities. So I think about it as we're raising money for you collectively, our 11 community region, and trying to make sure there's resources for older adults, adults living with disabilities, and their caregivers. So for what are some of these things that fall in the gap? We're coming up on people that might need heating oil assistance. We did a lot of air conditioners this past summer. Recently, we provided someone with a microwave they needed. So those are just a couple quick examples of something that an individual might need. We also have some of the programs that were mentioned today that are the level of need in the community is much greater than what the government gives us. So we supplement those programs with privately raised dollars. through, a lot of that is done through grant writing. We ask many foundations for support. And then, Lorna, can you change? And then, how do we raise the money? There's, as I said, we do grant writing, we do direct mail appeals. We have a legacy society, a planned gift society, and we have events. We didn't have these events last year, but we're going to give it a shot this year coming up. Belly Full of Laughs is January 29th at Anthony's. We have our headliner, Steve Sweeney, Will Noonan, and Dave Radigan, and tickets are on sale now for $50 each, and tables are $4.75. It's a really fun night. There's a lot of great raffles, trips to the Cape, trips to New Hampshire, a lot of fun prizes people can win. Again, funds raised go back into the community. And Ain't Misbehavin' is going to be on June 25th at Greater Boston Stage Company. And that will be the Fat Swallow, Ain't Misbehavin', the Fat Swallow musical show. And those tickets are $75 each. And we have a pre-party before the show and then the musical. So again, those funds go back out into the community. So with that, I want to turn it over to Sean, so there's time for questions.
Thanks, Jenny, and thank you everyone for your informative presentations. So now I do want to open it up to any questions. So if individuals could do their raising of their hands down in the reactions, that would be great.
Was this helpful? Let me ask you that. Was this helpful to the folks who didn't present? I thank you to everybody who did present, but everybody in the call, was this of use to you? You can either be brave and tell us right now or tell me later, as they say. And what else would you like to know?
Stacy, did you, I see your hand is raised.
I was going to say I was practicing raising my hand, but typically I don't have any questions. I just learned how to do the reactions, but I can bounce it over to, I'm going to pick Debbie from
Debbie.
Revere. I think you have a question.
Thanks, Stacy.
And the plumber's back. I'll be right back.
I just want to say, Dan, I found it extremely helpful. Being one of the newer people that work with Mystic Valley, every time I speak with somebody over there, you guys are the best. Very, very helpful with us here in Revere. Angie, I love Lauren. Jenny, I haven't met you, but thank you. Amy, I can't even tell you how when I listen to you all, it makes me feel so good to know that that team is there in place. Kathy, Brian McDonald, I didn't know you were there and we'll be using you. Joanne, so again, listening to you all, I want to take you all and bring you to Revere and invite a number of families to come listen to you because the services you provide are just so wonderful. And I think in my head,
just put Mary,
you know, it's just great. It's great. I also have my assistant director here and he's listening too. And as we're on mute, we're saying, yes, we can do this. Yes, we can do that. Yes, we should get this. So it's just nice to know the resources are there. You make our lives so much easier here and you make the lives of our seniors so much better. So I just want to say thank you and thank you for doing this because I got to tell you, I have 6 pages of notes here. I was, you know, but thank you.
Thanks, Deb. That's nice. We feel the same way about you, by the way.
That's nice. Thank you.
Are there any other questions?
Yeah. Hi, can you hear me? It's Mary Frenny in North Reading.
Oh, Mary.
Oh,
Frenny.
Mary.
Oh, no.
I'm just going to say the same thing. Who needs Dan O'Leary with a staff like this? I just want to, I'm so pleased because both my staff members, Sherry and Sue, sat in on this. And of course, I know a lot of stuff about Mystic Valley through the years. So now they know more. And like I said, you all know how I feel about Mystic Valley. You guys did a great job. They're going to feel very comfortable calling when they have needs, and
Good.
you guys are amazing. So great job, everybody.
Thanks, Mary.
Thank you, Mary.
Thank you.
Any other comments or questions?
Pam?
Pam from Medford.
Hey, Pam from Medford.
Again, I just want to reiterate what the others have said. We thank Mystic Valley. Without you, it wouldn't go so easy here at the Council on Aging, believe me. We always know that somebody there is going to help us, get right back to us and help our participant in need. So whatever the need may be, we appreciate it. But I do have one comment. How are we going to get the word out to the public that much more and that much easier? We still have that block, I feel, that the seniors or other people in need don't know enough of what you have to offer. I know that you have the new brochures. Is there something else that you're looking at to do down the road to get the public community aware of what you have?
I'll throw that over to Sean Middleton. That's his job.
Well, we are upping our marketing and our PR game here, Pam. But one thing that Chrissy McKeeman and I have spoken about is doing presentations at the COAs to your residents and talking about and doing, if you will, a dog and pony show about who Mystic Valley is, what we do, and really, with your help, publicize this so that people will come. It might be not until obviously next year when things really, calm down and the COAs are open fully. But I think that is, going to where our residents, your residents are that are visiting the senior centers and finding more about us. And then working, with your communications and our communications, whether it be newsletters, social media, getting the word out there about who Mystic Valley is and how we can work with them and work with you on, providing these services. But I hear you, as Dan says, we've been around, for a long time, and we're still, creating that awareness about who we are. We're hoping to get better at that.
Pam,
If you have any ideas, Pam, please let me know.
Yeah, that's what I was going to say too. We're doing direct mail. There's cable TV. There's local newspapers. There's your newsletters. There's the things that Sean's talking about. But if anybody on this call has additional ideas, we all know this, there's no single one best only approach. It's many different ways to do it. And if people, you know your communities better than I do, any of us do. And if there are certain ways that people connect within your communities and that we can, in a good way, exploit those, just let us know.
Yeah, that's a good point that Dan makes. When I was working with Debbie and Revere, we really got down to targeting and what do the people read, what do they listen to, et cetera. So I would probably look at each community because, not everyone, reads the same newspapers or takes on the same communications to get their information.
I had a couple comments.
Sure, go ahead, Susan.
Susan from North Reading. So I bet you as directors and senior center workers, you get calls from social workers at hospitals that don't know what a senior center is and what they have to offer. I think Sean Middleton could market to geriatric doctors if they have some type of meeting where they have an organizational meeting where you could go and explain to them when you're in the office and you see a couple struggling and they need care to reach out to the Mystic Valley Elder Services, North Shore Elder Services, because you're a lifeline and the doctors sometimes don't know that. And I think that the social workers, if they don't know what we do as senior centers, then if you can educate the people that are in the office with the person that needs the help at home, that they can make the referral right from there.
That's a great idea, Susan. And actually, we just did that a couple of weeks ago. So we sent an email blast for looking to our professional referral sources in our 11 communities. So it went out to over 1,100 emails, including, doctors that see elderly, social workers, other healthcare professionals. So this just went out last week. We also have a new, as Sandy Paul was talking about, a new referral form that is up on our website that they can fill out. So we are taking that action. We are hoping that we will get more referrals from this email blast. And we will continue on to not only, last year was looking at self-referrals from our, public, but now we also need to also look at our professional referrals for them to know who we are and refer the patients to us.
Susan and everybody else in the call, I would also say, as we don't know everything. I'll just say myself, I don't know everything. So if there are new things that are occurring at your communities, at your councils on aging, that you want us to know about, make sure we know about it. So that if something's happening in North Reading, a new program or just maybe a one-time program, let us know, let Sean know, or you send it to anyone, any one of us, quote, no wrong door, it'll get the right place. But if we know about it, then we can help promote these programs that you are talking about, Susan,
Right.
and everybody else.
With that said, I maybe refer to Lauren Reed on this one. Recently, we went to some of the outreach workers sat in on a hoarding meeting, and a woman and her husband developed the Buried in Treasures program. They say it's an evidence-based program, and you have the Healthy Aging program that reaches out to our 11 communities. Could you get somebody to be certified to do that class and offer it in the 11 communities rather than each one of us reinventing the wheel trying to get educated about it?
Well, it has to be approved through Elder Affairs and HLCE, but can you send me some information about that?
Yeah, because there is a cost for the person to get the materials and the training, and then that person's allowed to reach out to whomever they want to. They can do it in their senior center, or they can do it through Zoom. They've developed it on Zoom. So I think it's a great way to reach our 11 communities, because if I did a program on hoarding, I'm not sure I could get someone to show up.
I know, what's it called again?
Buried in Hidden Treasures. I can email you. I have your email.
Sure.
Thank you.
Yeah.
And I will say that Donna Corvelli does a wonderful job on her programs. We use her, so I would recommend using Healthy Aging at your senior centers.
Thank you. Yeah, she's a treasure.
The Balance in Fall class. I was surprised how many people were trying to, fight to get in to take that program.
Love it. People love it.
Yeah.
Hey, this is great, folks. I'm glad you enjoyed it. I'm going to say, we may be signing off the Zoom call, but it's not the end of the conversation. If you think of things, questions, suggestions like Susan just did, just shoot Sean an email, or me an email, or whatever. This is an ongoing conversation. So from all of us at Mystic Valley, I just want to say thank you to all of you out in the communities, our partners. I truly mean that. And I think Mary and other people on this call know we actually not only say it, we actually live it. And so I welcome you as partners in this, and let us know how we can work together. So anybody else? Sean, you're the host of them. You want to have the last word?
Yeah. And if you didn't get your question in today and you think, like Dan was saying, you think of more, please email them to me at smiddleton@mves.org. Also, along with the recording of this, we will also send out a listing of our program directors that spoke today with their contact information, so that you can reach out to them personally and have their information on hand, so that you can bug all of them.
I love it.
But I appreciate, as Dan says, I appreciate everyone joining us today. I'm glad this was helpful, and perhaps more in the future as well. And please keep in touch. Call us with any other questions you might have, and let us know what's going on at your COAs that we can help you out with.
Thank you.
So thank you, everyone. Have a great day.
Thanks, everyone.